Okay, so I guess we will get started with our first Teal Talk Thursday, brought to you by Rape Response Services. We are going to be doing a Teal Talk Thursday every Thursday in April for Sexual Assault Awareness Month from 3 to 4 o'clock. So our goal at Rape Response Services is to support survivors of who have experienced sexual violence or anybody who's been impacted by sexual violence. And to do prevention work in our community. So our hopes in doing these is to share a little bit more information about our services, and so people can see a little more in detail about what we do in the community and who we partner with. So today we have Dani, who is a forensic nurse, with us today to kind of explain her role and how we work together to support survivors. So I will let Dani introduce herself.
Thanks, Lori. Thanks for having me at the first Teal Talk. I'm so excited to celebrate SAM this month. So my name is Dani. I am a state credentialed S.A.F.E nurse for the adult adolescent population, and I'm currently gaining state certification towards S.A.F.E, so that's for the pediatric population within our state. And I've been involved in the forensic specialty since about 2018, and I've been a nurse since 2013. I hold the position of regional coordinator for the SANE program at the University of New England, and my primary objective there is to assist with recruitment and retention, education, and to support nurses who respond to sexual assault survivors, typically in hospital, emergency departments, but other healthcare settings too. I serve Penobscot, Piscataquis, Somerset, Hancock, Aroostook, and Washington counties. And my peer, Emily, serves all other counties within the state of Maine, and we work in partnership with the Office of Child and Family Services for the state, and we work with collaborative partners like Rape Response Services. My clinical background is at Northern Light Eastern Maine Medical Center in the emergency department, and I currently work there in a per diem capacity as a forensic and staff nurse.
So Dani is phenomenal, super busy, as you can tell. We are very lucky to have her and very lucky to be able to work with her. She does a lot of great things for the S.A.F.E programs in the hospital. So Dani, I was wondering if we could kind of start off with what S.A.F.E means. I know that when I first started this job, I had no idea these programs existed. So I kind of feel like, what is it about? What does it mean? And, what does that look like?
Definitely. And when I was a nurse who graduated in 2013, I had no idea that this was a nursing specialty too. So I feel like we're not alone in that. So S.A.F.E stands for Sexual Assault Forensic Examiner. Sometimes we're referred to as SANES or Sexual Assault Nurse Examiner, and you can really use the terms interchangeably. When we're talking certification, S.A.F.E is the credentialing term used for the forensic nurse in Maine, whereas SANE is the term used if you're nationally certified through the International Association of Forensic Nurses. So when I talk about forensic nursing, it's really specialized nursing care that focuses on patient populations affected by violence and trauma all across the lifespan. And it includes education, prevention, detecting and treatment the effects of violence in different individuals and families and communities. And when I speak to the community, I don't just mean, the typical populace of the white person in Maine. It also includes individuals who are Black, Indigenous, people of color, and LGBTQIA2 community. So the forensic nurse, in tandem with community partners in that professional collaboration, work to understand the effects of trauma, personal health, effective ways to intervene and prevent violence and trauma. Even though we call ourselves sexual assault nurses, we're also knowledgeable and trained, and we're invested against human trafficking, domestic violence, child and elder abuse, abuse against individuals, and those with intellectual disability. So there's a whole scope and sphere of practice there involved with being a forensic nurse.
That's incredible. I don't think I even knew some of those. So thank you for sharing that. That's amazing. So I know that this is kind of an interesting topic or an interesting kind of niche within nursing. And so I've talked with some nurses before, and hearing about the forensic nursing is something that always sparks an interest. Like, what is that, So could you explain like the process of becoming a SAFE nurse and what that looks like if somebody were to want to do that?
Yes. So the first step is usually attending the 40+ hour training that's hosted by the State of Maine SAFE program. But there are some other additional criteria requirements to be credentialed as well. Some would be attending multidisciplinary teams like SART teams, which stands for Sexual Assault Response Teams, or Community Violence Response Team. It includes having experience in a clinical setting. It involves certain experience performing vaginal exams, precepted medical forensic exams, exposure to how to testify in a courtroom setting, and attending meetings and other educational sessions that pertain to the forensic nursing specialty. So anyone who's interested, like any nurse that's interested in becoming a forensic nurse, is welcome to attend some of our educational sessions. We do encourage that if you attend the training, that you be a nurse for 1 year to get some clinical background and critical thinking skills before diving into a specialty. But there is a specific criteria that really is applicable to our practice. And it seems like it's a lot, but it really is easy to, not easy, but you're able to conquer it and be prepared to be a credentialed forensic nurse in our state.
Mm-hmm. I feel like it's a lot of responsibility. I've seen you guys do your work, and I don't know if I could be that detail oriented. So in order to perform a forensic exam, is it only somebody that's certified that's able to do that?
That's a really great question. So really, any nurse can care for the survivor that presents to the emergency department. Yes, forensic nurses have specialized training, but any nurse can assess for injury or provide prophylaxis for STDs, even complete the evidence collection or sex crimes kit. That's all within the scope of a nurse. It's just helpful to have that forensic background and that training to help with other items like trauma-informed care when with a survivor and having an encounter in that setting.
Okay. So one thing that I kind of wanted to ask you so that we can kind of explain to people what happens, because again, when I first started, I had no idea that this was offered for people who have experienced sexual violence. And so it's a really unique, amazing support service and medical service that people can receive. So how do people come to you in a sense, or what are some reasons why people would seek out a SAFE exam?
Typically an individual would come to the emergency department if they've been sexually assaulted, and they come usually by their own means, like car, or a friend supports them and brings them. Sometimes they come via EMS or by the police. So it can be a various method of transport to the hospital. We are so fortunate in Bangor to have 2 different hospitals, both St. Joseph Hospital and Northern Light Eastern Maine Medical, that can serve survivors in the emergency department setting. But regardless of where someone lives, I would always encourage them to go where they feel comfortable, and usually it's the hospital nearest you. And even if you're not sure if there's a SAFE program or a SAFE nurse at the hospital closest to you, that's okay. I think the goal of any hospital is still to provide medical care and safety, and to start connecting those resources to support you.
Okay. So when somebody shows up at the hospital, what does that look like?
I'm sure it's a little different everywhere, but I'll speak to what I know from my clinical practice. So once a survivor is identified in the emergency department, we tag them immediately, if one is on staff, with a SAFE nurse, and they become your provider. And it's a one-to-one assignment. So what that means is there's one nurse for one patient. And because the system honors that trauma has existed and that the situation really warrants someone wholly dedicated to the care of that patient. If you're honoring trauma-informed practice, that means mindfulness of when and where you're asking questions in the department. We really try to have a level of that practice in our department. We're not repeating questions, so survivors aren't speaking multiple times about details of the assault. We try to do patients direct to a room for privacy and discretion and just to have a safe place that is their own. When we're detailing what to expect, what happens in the hospital, I can provide like a few key items that someone could expect. Mm-hmm. So the first would be like a medical screening exam by a physician or a licensed professional, like a physician's assistant. And we're assessing immediately right off upon your entry, whether there's any life-threatening injury or bleeding or pain. And typically the SAFE nurse will work in tandem with the provider, with the advanced practice provider when you first enter the department. So I always like to tell my patients that they are the VIP. From the point that I meet them, they really drive the encounter and the interventions that happen at the hospital. The SAFE nurse has a variety of interventions available that they can speak to based on their experience and what's available in their medical forensic exam, and should present all the options to the survivor. But it's really up to the individual to choose which interventions they would like to elect. That's also part of trauma-informed care. We're giving the power back to the patient to choose what they want for their own body based on, their feelings, their inclinations. Some key pieces to a medical forensic exam include a head-to-toe assessment, again, for injury or bleeding or pain, to document all those items. We're providing emergency contraception if so warranted or elected. We provide STD prophylaxis, and both those items are really oral medications, oral pills that you can take while in the department. We talk about HIV or post-exposure prophylaxis if that's been a high risk for an assault that is high risk for HIV, and that's something that we can even start in the emergency department. There's an option for photo documentation, for any imaging, for an evidence collection or the sex crimes kit, and we also talk about safety at time of discharge. So there may be some intricacies from hospital to hospital, but I would say those are really like the core items that are available to the patient, the sexual assault patient.
Okay. So it sounds like there's a lot of things that can go into this, and it sounds like it can be really extensive. And I know that you had mentioned that your practice is really trauma-informed and client-driven, which is phenomenal. So when performing the kit, what does that kind of look like for the patient as far as like communication with the nurse goes and time and all of that good stuff?
It's a great question. It's the process itself can be lengthy if you elect for many of the interventions. Evidence collection can be minimal or very whole, depending on the choices of the patient. We have the option to focus on a particular area on the body or complete swabs head to toe. I like to talk about both consent and assent in the emergency department. And what that means is when I present options to a patient, I'm providing informed consent, which means that I'm telling you why I think this may be beneficial to you based on my experience, and also telling you the risks of declining a certain intervention, which is totally up to their discretion. And then assent is like continued consent. So even though I asked you when we first met if you would like to continue with evidence collection or a certain medication or emergency contraception, I'm going to ask you again before we continue, just to make sure that you feel comfortable in that choice, and that consent is continuing during our time together.
Yeah, it's really, I know like a lot of people haven't been able to experience it, but it's really amazing to see the one-on-one experiences that happen in those rooms. And just the patients and, the connections that are made. You guys do phenomenal work.
I think the worst thing for me would be to induce any additional trauma on top of what someone has really experienced. So maybe that makes me a little more hypersensitive about asking about the different interventions and continuing to ask during our time together. But I think that's really important as part of trauma-informed practice. You asked me a little bit about evidence collection, and I can speak to that briefly. If there is a particular suggested time frame for evidence collection, if you have a vagina, that means there's a 7-day window to collect evidence collection. If you have a penis, it usually reduces down to about 3 days, but there are exigent circumstances where that timeline is very flexible. Sooner is always better based on my perspective, but that's selfishly because I want to support and ensure the health and safety of the survivor, but it's their choice to make. So whether it's been day 1 since the assault or day 5, I would still encourage you, if you are so thinking of completing a sex crimes kit, to come in. And even if you're not sure, then I would encourage you to call the sexual assault helpline or just come to the hospital and seek medical care and go from there. The evidence collection kit can be completed anonymously or be reported with your name supported behind it. There are some instances where we're mandated reporters, and so we would have to connect with law enforcement. But ultimately, typically, it's if we're talking adult or adolescent, they have the choice to be de-identified or identified evidence collection if they want to report or not. So the evidence collection is housed at a law enforcement agency for up to 8 years, which is a really great window, and it gives the survivor a good length of time to think about and choose the path of action that they would like to take for themselves.
Yeah, that's a lot of information. Thank you. So when somebody comes to the hospital, when we say like forensic nurse and sex crimes kit, I think about like CSI and police and reporting. And sometimes I know that can be intimidating to people. Sometimes it's safer for them not to report. Sometimes it can just be overwhelming. So do the police get called as soon as somebody comes in, or what kind of control does the individual have in that kind of situation?
Yeah, so with the adult survivor, it's at their discretion if they'd like to connect with law enforcement or not. Our first call is not to law enforcement when a survivor presents to the emergency department. It's typically actually rape response to provide advocacy service. We are mandated reporters as nurses. So typically if there's children involved, then we're required to connect with law enforcement. But the majority of the cases is the adult survivor, where we can support their choice, whether they'd like to pursue legal action or remain anonymous. And that's a choice that's completely up to the patient. We, again, provide all the information as part of informed consent of which path to take, but it's not my path. So we would support that of the patient, because that's the one that they would endure and think about post discharge.
Okay, so it's really all in their control. So the other thing is, when we talk about the emergency department, one of the things that comes to my mind is like expensive. So can you just explain kind of what's out there to support these services, and how those services support survivors in seeking the care that they need?
Yeah. So in our state, we have a program called Victims Compensation. And so if you are a sexual assault victim and elect evidence collection in this setting of an emergency department, Victims Compensation will compensate the hospital up to a certain amount. And in some cases, not bill the hospital or the hospital can't bill you for the remainder of the assault. there are some cases where, or some circumstances where things like imaging may not be covered, but it is really beneficial to know that there are programs and services as a victim of crime that can help compensate for a hospital expense, because I feel like that's insult to injury, right? To receive a bill in the mail for an assault that was because of an assailant, not by anything that you had done. And so that's one option. I always encourage, if you're a nurse that's listening, to find out about different philanthropy programs that are available through your hospital to promote that within your community, whether it's patient assistance or a specific philanthropy program that someone could appeal to with compensation for their bill. That's always an avenue to take as well.
Okay, thank you for that. The other thing that kind of I was thinking that's unique about the forensic exams and things like that is the confidentiality that you guys require in the hospitals. Could you speak and elaborate on that a little bit?
Yes, that's a really great question, especially in smaller communities, right? I feel like there may be some hesitation to go to your hospital because it's a small town and you don't want people to be talking about your assault. HIPAA is still applicable as a sexual assault patient in the emergency department. As part of trauma-informed care, we as staff, a hospital staff in the department, have learned that it's inappropriate to be just discussing details of an assault amongst peers in the hospital setting. For my hospital, we are fortunate in that all the documentation is not contained in the electronic medical record. It's actually old school pen and paper and housed through a certain pathway that's very protected. And that's an additional layer of security so that someone just can't click on a file and see someone's very, vulnerable medical record. I think all those things are applicable and important to remember, not just with a patient that has chest pain, but especially in the case of someone who has been assaulted. Some hospitals have the feature of making a patient a no news patient, which is an additional layer of security so that, certain portions of their information at registration are blocked. Just different items in that case. And if you have a trauma-informed practice, all those things should be falling in line automatically.
Okay, so the files, you have to have special kind of permission to access them. So does that mean not everybody in the hospital could reach them, only specific people?
Yeah, at our hospital, and I can't speak for everywhere across the state, but at our hospital, it's pen and paper, and we maintain chain of custody, and it's essentially under lock and key with only a certain, individuals listed as appropriate users in medical records that can access them. And so it's, I find that provides that additional layer of security than an electronic medical record.
So it wouldn't show up on somebody's primary care provider record, is that?
I think a lot of that depends on the manner of which the advanced practice provider dictates the encounter. When we triage someone in the hospital, when someone is giving us their presenting a complaint, we try not to type sexual assault as that presenting complaint. We'll write assault. So just different semantics to provide an additional layer of security. As far as what's available on the doctor portal for Health InfoNet, I can't speak to, but I know that our advanced practice providers in the emergency department make a really conscious choice to be mindful about how they're dictating and presenting that information while still being accurate to the medical care, but also mindful of their privacy.
Yeah, I really appreciate that aspect of it. I think it's important to, have that story maintained with the survivor. It's theirs, and not ours to tell. So I think that's very awesome. So as part of, the process of a S.A.F.E exam, you have the support of advocates. Could you tell us a little bit about what that's like and how important we are.
Oh yeah. Listen, I won't just give you lip service because you're like right in front of me, but I say all the time that involving like an advocate or an advocacy service is a serious game changer for the survivor. I care for a patient in a brief period of time in the timeline of their trauma history, but advocacy services continue their services from when my care ends, right? And so every time a patient presents to the emergency department, one of my first phone calls is to rape response because they're so beneficial in supporting the patient in their greatest time of need. They are integral to help facilitate healing in this terrible time, right? You guys are so empathetic and understanding and knowledgeable and resourceful, and you're someone who should and who you would want to be in your corner in such in such a time. So I gush all the time. Yes. So in the cases where a patient may not want to connect with rape response is still coming and leaving some information with me to pass along to the patient. And I know just that thoughtfulness in and of itself is very meaningful. And you guys go above and beyond. I've seen it in practice. And so it's not just about forensic nursing. It's not just about law enforcement. You guys play a really large piece of that healing, and we're a village and we can't do it by ourselves.
Yeah, I think one of the most special things about the whole S.A.F.E program is just how integrated they are into, the community. It's a team effort to support people. And I think we were just talking about it before, how empowering it feels to be a part of that and work towards that goal that's bigger than ourselves. And you guys are really phenomenal too. I don't want this to be like a talk each other out kind of thing, but I will say, when I first started this job, it was kind of like, I don't know how this is going to be, but in those rooms, the nurses are amazing. They're super empathetic as well. And it's just this holistic kind of support that you get there. And then we're able to follow you after the fact and support you with whatever your needs are. And so it doesn't just end once you leave. So there's somebody that's going to be there bugging you a little bit if you want us to.
Yeah, and it's when we talk about trauma and things like vicarious trauma, it's so beneficial to me to have those like-minded connections. Like the nurses at St. Joseph Hospital have been an amazing role model for me, and same with the friends and co-peers that I've made at Rape Response. It's such benefit to my practice and to my life. It's just very fulfilling.
I love that. Yeah, it's a unique job, and you have a passion for it, and I can tell, and it's nice to work with people that are all passionate about the same thing. We get a lot of good work done. So I'm trying to think of some other questions. Is there anything that you would like to say that I didn't cover?
I think we hit all the major questions.
And we can sit here and talk each other up. We can never, say how awesome we are. Not really, but so if people were to, we just had a question. Sorry, that was awkward. It's a good one too. So, are parents informed of visits to the hospital?
That's a great question. So, with minors, is different than children. So, children, yes, we were required to notify a guardian. With a late adolescent, there are different instances where we would not notify the parents, but parents may be notified about a child's, the minor's visit to the hospital if they see it on their hospital bill. So we're not trying to be deceitful in any way. We support the desire of the patient. If they're able to make that decision, then we would support that. So in my experience, we've always had a caring guardian that is accompanied, a minor. So that is very heartwarming to me to know that someone's not alone in dealing with their trauma. But it certainly brings up some good questions.
Yeah. So what are those ages? Because I know that there's ages where somebody can consent to parts of the kit, and then, as you get kind of younger. Yeah. What's the difference between, somebody who's a little younger versus somebody who is a little older?
Right. Like someone exams. 9 and 17. So typically it changes when someone is post-pubescent. So typically 13, 14. There's a difference. There's not always a difference in care. There's a lot of the aligned practices for both a pediatric patient and an adolescent patient. Some of the interventions that we talked about are still applicable. Oftentimes with pediatric patients, we're bringing on board additional services, whether that's DHHS, the Child Advocacy Center, we connect with SPURWINK for consultation. So that may be some differences between the two.
Okay. And for the child exam, I know that when we talked about the ones for the adults, it's kind of extensive. Is that the same for the kids that come in?
I think that's a good question. I think that it's very scenario specific. With a pediatric patient, we're really trying to do no harm and minimize the amount of trauma that the child would endure post-assault. And so it's a very rare instance that we would be electing for evidence collection. A lot of it is beginning the stages of healing and connecting with our resources and, completing a head-to-toe assessment to tell the non-offending guardian and the patient, like, your body is healthy and you are safe, and all those different things to help walk down that road of healing.
Okay. So I know it kind of brings me to another question. So I know sometimes we think that when we go to the hospital and we get an exam, people can tell if something happened. And so what does that look like? What's the knowledge surrounding that?
I'm glad you brought that up. Good point. The head-to-toe exam is part of the medical forensic assessment for the SAFE nurse. And there are times when someone has been assaulted and there is no visible injury to the body. That doesn't mean that I don't believe you. That doesn't mean that it didn't happen. It means that I don't see anything visible on your skin. And so we really try and inform someone and support someone that I believe you, despite XYZ, and I support you, and what you're telling me is true. And also beginning that conversation of, I see that your body is healthy because there's nothing visible to me. There are times, like, say, in strangulation, where someone may not have any visible injury, but in those cases, I might push for some additional imaging because there's a lot that comes to strangulation that can be, near fatal assault, and so there are some additional interventions in that case. But if, I don't want you to feel like, I don't want the survivor to feel like I won't be believed because, my body looks good. I would still encourage someone to come to the hospital to seek medical care post-assault.
Mm-hmm. Yeah, I think sometimes we have this myth of, of an assault being something that can be, well, it can be violent, but sometimes, we do what we do to get through it, and that means, sometimes there aren't any marks, but it doesn't mean it didn't happen. When somebody does a kit, how often are those kits actually prosecuted?
Oh, I don't have the specific numbers. I know that it's very low in relation to the amount of assaults that happen or the amount of kits that have been collected for that year for that hospital. An evidence collection kit is sent to the crime lab once it's been, I don't know the proper terminology, but picked up by like the DA's office, or if it's going to be prosecuted or investigated, that's when it's sent to the crime lab. And so I'm thinking that it was maybe like 40 kits last year, which is a very small piece of the amount that were collected or that occurred. So, in other states, they do programs like kit tracking, immediate processing, and those are all opportunities for our state. It's just not happening right now.
Mm-hmm. It's good to know. Yeah, I know sometimes when we think of like evidence collection and all of this stuff, we think about prosecution and like the court process and things like that.
Yeah, and it's good. Sorry, it's good for the survivor to know too that your evidence may not be processed right away or for a period of time. That where the location is the law enforcement agency, and that's part of the informed consent.
So I know that you had mentioned something regarding prophylaxis and STD treatment and all of that. Could you speak a little bit more to that and elaborate on what options you all have?
Yeah, prophylaxis is a fancy word for prevention. And so when we're talking STD prevention post-assault, we're really not testing. We're just trying to treat any possible infection. So things like chlamydia, gonorrhea, bacterial vaginosis, STIs of that nature. Emergency contraception would be something like Ella or Plan B, depending on what your hospital is on their formulary. And it's mostly oral medication, or, sometimes it feels like a meal. There's so many pills, but a lot of antibiotics included in there to help with the treatment of those possibilities post-assault.
So why is it that you guys don't test for STDs and you just treat them?
It's a lot to do with timing. An STD may not be positive on any blood work. So we just want to take care of it and kind of be proactive than reactive. And so that's where the provision of medication comes in.
Okay. That's very thoughtful. You never really think about like the time sometimes things take. So we have a question about human trafficking, and I know that Rape Response does work with human trafficking, but how do the hospitals collaborate in that kind of circle of the team to combat that?
Yeah, we in our hospital, we serve human trafficking survivors, as does St. Joseph. They have a fabulous program and are part of the START response, which I think is stellar. And so I rely greatly on Rape Response if I've identified a human trafficking survivor in my emergency department. I think a lot of the interventions are the same, like it's still trauma informed, it's still patient centered. And I'm using a lot of resources like I would with a sexual assault.
I won't go too far into it because we're going to do a Thursday with human trafficking. But can you just kind of briefly touch on like when you say you identify somebody, what does that look like? And then the safety surrounding that?
Yeah, it's a big question. So with an adult that's being trafficked, I think the first, they may not make a statement outright that they've been trafficked, right? It might be that they don't know what city they're in when I've asked them a question, or they may not have their wallet or be in charge of their documentation, or they don't know their address. Some of those things are all clues to me that trafficking may be existent in their experience. We have a lot of different stereotypes about trafficking looks like, or even some denial that trafficking is even happening in our community when it definitely is happening in Maine. So it takes a lot of discretion and mindfulness about patient safety when I'm considering the trafficking survivor. Can I have a safe conversation with this person? Are they looking to get out of the life? What do they need? Usually it's the patient that can tell me what they need, and I can try and meet that in the time that we have together. And again, connecting them with supports, because I'm just one person, right? Where there are other resources out there that are much better served to support them.
Mm-hmm. Yeah, I know that Rape Response Services partners closely with Courage Lives, and they do a lot of work in the community regarding human trafficking. So it really is, once again, one of those team approaches, community approach, where a bunch of different professionals are working towards the same goal. So the other question that I have here, or thing that I think it would be cool to bring up since it's kind of new, and it really provides great opportunity for safe nurses in training, is the Telesane program.
Totally. I brought that up. I have to shout out to someone later, I'm sure. So the Telesane program is a really cool initiative. So it's grant funded through the University of New England in partnership with Northern Light Eastern Maine Medical Center. And what it is a experienced, credentialed SAFE is able to be present in a virtual setting like Zoom, while the SAFE in training who's physically present with a survivor provides care. And the intent of Telesane is to help precept those nurses in training so that they are providing best practices, they're giving trauma-informed care, and they're doing that in tandem while supporting the survivor. So someone from Rape Response once said, like, how cool is it that 2 nurses are caring for a survivor as opposed to just one? And I've always kind of, kept that with me. It's going to be a special place of healing that both benefits survivor and the nurse that's in training. So what it looks like is the nurse in training with the patient in a patient room. And then we've got this little computer on wheels with a really expensive looking camera that comes in, and they're docked there, and the person would communicate via Zoom just like you and I are doing right now. And they can be there for the entirety of the exam to help precept that nurse in training. And the goal to that is to continue to credential nurses across the state. And it will hopefully help with that ripple effect of getting experience in all the different areas, both rural and more populated like our area here.
Mm-hmm. Yeah, that's great. And I know we're lucky here in like the Penobscot County, where we have a lot of SAFE nurses, and we have some awesome hospitals that provide those really great services. But I also know that there's some hospitals, they offer services, or, they don't have like the certifications. So having that opportunity to get that, especially where we live in such a rural state, is really amazing.
Yeah. With one of the pieces to credentialing having precepted exams, that's really difficult to obtain if you're way up there in Presque Isle or in Greenville, and so even Ellsworth. So I think this is a really great opportunity to expand that reach with experience.
When you say precept, that means like somebody observing it, right?
Mm-hmm. Yep. Yeah, it's a great question. That credentialed nurse that's on the Zoom platform, providing guidance and support to both parties, right?
Mm-hmm. So it really takes a lot to get the certification, and you guys go through quite a bit. You have the training, and then you have the actual exams where somebody has to observe you who's already has the certification.
Yes. Yeah. I feel like if you're passionate about the work, it's not that daunting to complete. It's just necessary items to become credentialed. And it's such, I'm always hungry for knowledge, especially when it's something that I'm passionate about. And so the credentials all make sense to me, and they provide really great insight to what a forensic nurse looks like and what they do.
You guys do a lot. It's not, it's not just the typical care you get from a nurse. It's something so much more than that. It's amazing to be a part of. So I appreciate you all.
Yeah, ditto.
So I don't know if we have any more questions, but we can just wait a little bit. Maybe I'll come up with something.
And water, see if anything comes up.
Okay. So we got another one. What happens to a survivor once they leave the hospital?
That's a great question. I think that's very patient specific. Everybody has a different life after they leave the hospital, whether they're unhoused or, living in a collegiate setting or have a place to call their own. Laura, you might be able to speak to this better than I will, but that's where I feel rape response really comes in, because they're that continuing support once a patient is discharged, so that they can connect with them. If there's any accompaniments in the future that they need that support on, that's where you guys are really helpful. And that's my take on it at the stage.
Yeah. No, so I think that's a place where our services do kind of come into play frequently. We support people who are impacted by sexual violence, but oftentimes being impacted by those things changes your entire life. And so sometimes that means, you're not safe going home. Sometimes that means, you need some help finding legal services and things after the fact. And so we really are there to support people through that and to make sure that they're getting their needs met. Another question that we have is, sometimes, we see people and they come in and they don't know what happened. How does that kind of work?
My mind kind of two different avenues. Sometimes assault is drug facilitated, and so they may not have any memory of what happened. And that's where the care of both the forensic nurse and rape response are really integral, because we're there to support the patient and to provide an assessment that tells us a little bit about their body, if there's anything visible or not. If there's any questions about an assault, you could always start with the helpline too, for any direction, or come to the hospital, baseline for medical care to ensure that your body is healthy, and that you're in a safe place for, if there's any consideration there about what happened. Those are different things that I would suggest. If I wasn't sure, I would seek out some supports.
Do you all do drug testing at the hospital so that you'd be able to see? How does that work?
Yeah, as part of the evidence collection kit, we have the ability to send both blood and urine specimens alongside other evidence, and so that's always an option. Sometimes we can do testing at the hospital, but many drugs are metabolized so quickly, so it's tricky to see any positive values in those specimens. But I wouldn't want that to deter anyone from coming and having an exam.
What would you say one of the biggest values?
Sorry, you froze on me for a minute there.
Oh, it's fine. I can repeat it. I was just going to say, what do you think is some of the value of seeking out medical care after an assault?
I think it's important for anyone who's endured assault to seek out medical care, whether you're a child or a minor or an adolescent. I think that's a really important piece of healing. I think that's a really important piece of body autonomy and, your overall health. That's my perspective. I don't know if everyone shares that, but we have one body, and I think to have an assessment of it, especially after something traumatic, is never a bad idea. There's no harm that can come from that.
Mm-hmm.
I should say too that when we're talking about like something like drug facilitated sexual assault, that alcohol is one of the biggest contributors to that. And so, a lot of people, when I share the information, they're surprised by that. They're still thinking it's like roofies or some like medicine or drug that they've seen in movies, but that can be a big piece that someone's taken advantage of that vulnerability because someone's chosen to drink alcohol.
Mm-hmm. Yeah, absolutely. I think a lot of that has to do with our culture around things like that. And, just because you drink doesn't mean that people have the right to, do things without your consent.
We have another hour about rape culture. Let's keep going.
Yeah, well, we'll get on that. I might get a little too amped up. So, yeah. So we can just wait a little bit. If anybody has any more questions, or if you think of anything that you would find, helpful to share. I know that there's so much, and it's just, yeah.
The one thing I always like to impart on someone is it's never anyone's fault to be sexually assaulted. It's never okay. I think people should be held accountable for inflicting trauma on someone else. And so if there's any hesitation to seek services because of shame or guilt or regret, I would encourage anyone to put those aside because you're so important and what happened to you wasn't your fault. And so, I would gladly welcome someone that's seeking care in a hospital setting.
I completely agree with that. I always like to tell people, you didn't have a choice. You didn't make those choices. Don't wear the responsibility of them, so.
So true.
Yeah, so not sure if that's it. We have like 9 more minutes or so. So I'll just kind of say, from our end at Rape Response Services, how we get called to the hospital, and kind of what we come prepared with to offer for services. So the hospital typically calls us through our helpline 24/7, any time of day. So if somebody goes in at 1 o'clock, we're there at 1 o'clock. And so we're there. I have a Teal folder actually right next to me. We bring these lovely famous Teal folders that have a bunch of our information on them. And we can kind of keep track of like who the nurse is, what the kit number is, and kind of just some of that information that sometimes gets missed because people are tired. Your mind's going in a million different directions. And so we can, be there for that support. And then also, if there are things, sometimes it's hard to speak up. Sometimes it's hard to say certain things. And so we can be there for that support as well. And we bring clothes. So sometimes what happens is people have to, they have a choice. Everything's a choice. But giving up some clothes, which I think is like the biggest bummer of it all sometimes, because you got like a really nice sweater or something, and it's, it's not fair. But anyways, we have comfy clothes to give people, if that happens to be something that they need to do or want to do. And then we're really good at following up and, just meeting people where they're at. And I always like to tell people, we're here, but if you don't want to talk to me, you don't have to. It's a complete choice, but, I'm going to call you a few times. So, yeah. Thank you, Danny, for taking the time out of your busy, busy life to do this.
Dude, it's totally a pleasure. Like, what a great opportunity to talk in an open forum about preventing assault and, all the community resources. It's my pleasure. So thank you for having me.
I was really excited about it. I was kind of nervous, but Before we started, we were both just like talking about how much we love this stuff and how sometimes you can't put words to the emotions that you feel because you're just like, so. I appreciate you being here, Danny. Thank you so much. Yeah, we're just so lucky to have the community that we do and how amazing and awesome everybody is. Like, I'll never get over it, but yeah, so we can probably sign off now, I guess.
Sounds good.
Thank you. All
Thanks, Lori.
right, bye.